The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Alex undergoes surgery to straighten her spine. Emma comes to the ER with an object stuck in her nose.
In the bone.
Alexandria's foot is reshaped.
Scheduled to take about an hour.
And Christopher needs a kidney auto transplant to save him from life-threatening high blood pressure.
See, we have to move the kidneys from way up here to way down here.
Yeah, test your abilities as a surgeon.
You're not going to just test them, man. You're going to challenge them to the utmost degree, buddy.
14-year-old Christopher has come to the hospital from his home in British Columbia.
Christopher?
Christopher.
Hi, Christopher. Nice meeting you.
He was born with poor blood flow into his kidneys, and as a result, has developed life-threatening high blood pressure.
Take blood pressure. Have you had blood pressure taken on you before?
Yes.
Pretty sure lots of times.
Doctors hope to lower his blood pressure by detaching his kidneys from their malformed veins and arteries and reattaching them to blood vessels in his pelvis, a rare and risky procedure called a kidney auto transplant. Today, Christopher will have an angiogram to assess whether the veins and arteries in his pelvis are healthy enough to support his kidneys and save him from a deadly stroke. His parents will stay with him until he's asleep.
And you can squeeze my hand here too.
Okay, the student feel, as soon as I feel the finger with the squeeze her hand.
We'll see you when you wake up.
Just relax, everything's okay.
Wonderful. Perfect. There we go.
All
Thank you very
right.
much. We're off
So
to
you guys
sleep.
can go
Thanks
back.
for letting us go.
No problem, no problem. Glad you could come in.
Now that Christopher has been anesthetized, his angiogram can begin.
All right, that for a fuss.
Christopher's interventional radiologist inserts a catheter into a major artery in his leg and will use live X-ray images to move through his circulatory system to assess veins and arteries in his pelvis.
Yeah, let me see where I am.
Come on in, follow me.
5-year-old Emma has come to the hospital with an all-too-common problem. This morning at school, an object became lodged in Emma's nose.
What did you put in your nose, Emma? Is there something in your nose?
She was playing with a little necklace that had
I wasn't playing.
You weren't playing with it? Okay. It had like a little nut on the back, very small, like smaller than a pea.
Yep.
And she said somehow it got in her nose. And it's bleeding a tiny bit, and she was complaining to her teacher that there was something stuck in her nose.
Can we have a look inside and see what's in your nose? You see lots of little boys and girls with things in their nose, okay? We'll have a little look and then we'll see. Which side did it go in? That one? Okay, let's look at the... Okay. What we'll try, if you're pretty sure that it's a foreign body, then we'll just see if we can try to pull it out with a little Tourette.
Okay.
Okay, I'm going to help you. What you need to do is try and keep your hands still. And sometimes you can put them underneath your bum. My mom's going to help you.
Can you see it?
Yeah. So it's going to be a little tickle, okay?
Need to fix your lead.
I can feel it, metal on metal.
I could hear it, actually.
And sometimes they come out very easy. Sometimes they can be a bit more of a struggle.
Okay.
Removing the object in Emma's nose is proving to be a challenge. Her doctor will have to try again with a different instrument.
How did that thing get in your nose? Can you tell me that? Did it fly in there?
Christopher's parents stand by as his angiogram is underway.
Okay, can we hold wrists, please?
Christopher's radiologist has good news for his surgeon. The angiogram shows blood vessels in Christopher's pelvis are healthy enough to reconnect and nourish his kidneys.
That's your...
So that's I
you.
can anastomose to this.
Yeah, that sounds good. So you...
And that's a normal vessel.
Yeah.
The surgery Christopher needs to save his life can go ahead.
So, how are you doing?
Good. So it looks like Thursday is going to be a go. The left kidney looks quite favorable. There's lots of collateral, there's lots of small little branches and vessels. They look like little worms all over the place.
Sure.
And that's going to be a problem because that is the major blood supply that's feeding the kidney right now. How is that kidney going to behave without those vessels is a big question mark. Okay?
Okay.
So the left side, we know we're okay, we can go ahead and do it. The right side is still in question. Okay. We need to move both of them down if we're going to control his blood pressure, but we may have to do it sequentially. We may have to do the left side once today, on Thursday, and then the right side on a later date.
Oh, my.
But we'll decide that later. I mean, we don't need to make that decision right now.
All right. Very good. Great.
Okay, guys.
Christopher's kidney auto transplant surgery is 3 days away. The surgery has serious bleeding risks, but Christopher's blood pressure must be normalized, or he will not survive. Back in the ER,
Hi.
Emma's doctor makes a second attempt to remove the object in her nose.
You went to your head again.
Let's try
Close
it this
your
way.
eyes.
See if this works any easier, okay?
Not a girl. Good for you.
Such a tiny nose.
Yeah, I know.
Good for you. Does it feel funny?
Oh my goodness.
There we go.
There you go.
Yeehaw. Up you go.
It's bigger than I thought.
It's a battery.
It's a battery.
Oh my
Oh,
goodness.
it's good we got that out, actually.
Yeah.
Batteries do give you the potential for some burning.
Right. Why on earth would you put that in your nose?
I didn't.
How did it get there? How did it get there? Did it fall in there?
Yeah.
Did it jump in there? What did it do? Why did you put a battery in your nose? That is the silliest thing I ever heard.
The most important thing, obviously, is to get the battery out.
Yes, it was only one battery, but there was another little piece. So
But it didn't fall in my nose.
it didn't fall in your nose? Okay.
Because if it's metal, the one other thing that we could do is to x-ray her nose just to make sure there's nothing deep in the back. There could be something left.
Maybe. Emma, do you want them to take a picture of you to make sure there's nothing else in your nose? Let's x-ray.
So we can
it then.
x-ray it just to be sure
Yeah.
that there's no more metal.
Emma will have an X-ray to make sure a second battery is not stuck inside her nose.
When I tell you, I want you to take a big breath in like you're sniffing flowers, okay? So you're just gonna keep your mouth closed.
Right.
A corroding battery could leak acid into her nasal passage and permanently damage her esophagus.
And I want you to sniff the flowers. Good.
It's the morning of Christopher's life-saving kidney auto transplant.
Wait, you're pushing fast.
His parents accompany him to the OR waiting room for a final meeting with his surgeon.
Dr. Curry, good morning.
How are you guys doing?
Do you folks have any questions? The one I forgot, like rejection, what?
No, rejection is not an issue here at all because
That's
it's his
what I
own
thought.
tissues,
Yeah.
right?
Yeah, right.
Our biggest challenge here is going to be bleeding, really. The kidneys are basically, they look like the kidneys covered in spaghetti.
Mm-hmm.
It's in a bowl of spaghetti, and these are all collateral vessels,
Right.
vessels that have sponged up from his abdominal wall, from the liver, from all around, from the back wall of the, beside his spine, all little vessels that are coming all over the place. And that's going to be a challenge for us to control all those and maintain a good circulation in his body.
Have you ever seen a kidney with that many collaterals before?
You don't want to
That's
ask
a
me
real
that question.
challenge.
No. We're going to do our best.
Yeah, test your abilities as a surgeon.
You're not going to just test them, man. You're going to challenge them to the utmost degree, buddy. And I'm telling you, you're going to challenge me to the 110% today.
All right. We better get going,
you guys.
Okay.
For the second time in 4 days, Christopher will be put under general anesthetic. Christopher's surgeon reviews CT scans of the abnormal blood vessels and collateral veins currently supporting his kidneys.
This is the challenge that we have. There's the two kidneys, one and the other, and these are all those little wiggly things all over here are those collateral branches that we talked about. And you can see that the kidneys are completely covered with those branches
trying to sponge blood in from anywhere it can. And these are not normal vessels. These are not going to be normal, healthy vessels. These typically are very fragile, thin-walled vascular spaces as opposed to arteries and veins, which makes them bleed very, very significantly. So we'll see.
Okay.
All right.
Next, please.
Okay, let's get started.
The team begins by making a huge incision from Christopher's breastbone to his pelvis.
Now, we're going to have collateral vessels even in the skin and the abdominal wall. I'm not surprised if we have more collaterals in the abdominal wall.
Christopher's abnormal blood vessels may not be limited to his kidneys. Even at this early stage of the operation, doctors could cut into a mass of collateral veins.
All the help we can get today, Chad.
If surgeons could not control the bleeding, Christopher could die in surgery.
All the help we can get.
It's been 4 hours since Christopher's parents sent him into the OR for what they know is a high-risk kidney auto-transplant surgery. His team of surgeons has managed to separate his left kidney from the mass of collateral veins, avoiding uncontrollable bleeding by carefully cauterizing each of the tiny veins to seal it off. And after 3 attempts, they successfully reattach the kidney to healthier blood vessels in Christopher's pelvis.
So that's the left kidney over here, and it's been hooked up. There's the vein here and the artery here. Oh, it's making urine. That baby's making urine. And so the question now is whether to proceed with the other side or not. I think the safer thing to do would be to let this side heal, and once we have this side healed completely, come back in 2 to 3 months' time and do the other side. I'm just reluctant to do the other side now and start jiggling this kidney and moving it around a bit when the anastomosis is so fresh and we've had such a difficult time with the main artery.
6, 7, 8, 9, 10, 11, 12.
Okay. Hey. How are you guys? Long day?
Been a long day.
Sure has. Must have been long for you too.
Yeah. Well, things went well. We hooked up the vein without difficulty. We hooked up the artery again and wasn't happy. It just didn't look healthy enough to stay. Redid it another time, still wasn't happy. It was almost like wet tissue paper, how it pulls off the anastomos. I had one of my colleagues come in who's one of our cardiac surgeons, and he helped me hook it up the 3rd time in a new spot on the iliac system, and it took nicely. But I think we should let this side heal and then go back and do the other side when we're comfortable that this one is healed completely. And I would say 2 to 3 months time we can get back in there and fix the right side.
Do you have any idea how this might affect his blood pressure now?
It shouldn't do much to his blood pressure yet, because the right kidney will still drive the blood pressure higher.
Okay.
Thank you so much.
All right,
Dr.
guys.
Curry?
Okay.
Thank you very much for all your good work.
Christopher has been moved from the operating room to the critical care unit, where he remains on life support.
Sound asleep, right?
Oh, you did so good. Thank you, kid.
Hey, big guy.
Oh, you're doing good.
You know you're not quite awake yet, Christopher, but
You're
I'm
doing
pretty sure
good.
you can hear us, so we're here for you.
Love
Okay?
you lots.
We love you.
Five-year-old Emma's x-rays are ready for review.
So this is an x-ray of you.
Look at that, Emma.
And we can make it a little bit bigger. There's your nose that you can sort of see. And that battery was in there, but I don't see any other batteries in there.
Okay, good.
Okay?
Excellent.
So it's just the one. You were right. Okay, good. So let's
Perfect.
just go back into your spot there.
Okay.
And we'll get you signed out. We just need to put some polysporin in her nose before she goes. Okay, let's go.
Tickle, tickle.
Okay, and just wipe your nose.
That's it.
Okay. And I would just do that 2-3 times a day. Okay, Emma, I think you're finally done.
So you keep one, I keep one.
Yeah.
Emma is now ready for discharge.
You did a great job. All right, nice meeting you.
Nice meeting you. Thank you
All
very
right,
much.
take care. And ENT should give you a call within a couple of days.
Okay.
She will be monitored by the ear, nose, and throat clinic to ensure the burn inside her nose heals well.
Okay, you're welcome. Good luck.
Let's go.
15-year-old Alex suffers from a severe form of cerebral palsy. Her muscles are so stiff, she is unable to speak or move on her own.
Thank goodness for strong fathers. That's all I can say. Now, Dad, can you just lean her forward a little so I can just listen to her back?
Now, Alex has developed scoliosis, a severe curvature of the spine, leaving her unable to sit up in her wheelchair.
Can you take in a deep breath now?
Today, she will undergo surgery to permanently correct the scoliosis. A rod will be wired to her spine to pull it straight.
Her CP is an unusual form of CP where it's called schizencephaly, and the frontal lobes of her brain didn't develop properly. She's very smart, doesn't miss a trick. A good brain, good thinking brain, just your body doesn't do what you want it to, right? She uses a head control for her computer for school and as a communication device, but when she's not sitting upright, it's more difficult for her to access the switch. It comes up beside her ear, and the power chair was a different device, still using her head, and she just hasn't been able to use it. So we're hoping to get her back in her chair. She used to enjoy chasing her sister around the driveway. They set up an obstacle course. Right? That was a long time ago, eh, Alex? Yeah. She knows what she's in for, and she's looking forward to it, believe it or not.
Surgery to straighten Alex's spine is 1 hour away. 18 hours after Christopher's surgery, he remains in the critical care unit, deeply sedated and using a ventilator to breathe. Critical care staff take him for his renal scan to assess the function of his repositioned kidney. Radioactive fluid injected into a circulatory system will be tracked to ensure blood continues to flow in and out of the repositioned kidney. If the renal scan shows poor blood flow, it will be a sign that the surgery may not have been successful, and that Christopher's best chance for winning the battle against high blood pressure may be lost. "15-year-old Alex is just minutes away from surgery to straighten her spine. Her mother will take her into the OR and stay with her while she is anesthetized.
It's going to be the fastest day for you. It's going to be the longest day for us.
But first, Alex meets her orthopedic surgeon one last time.
Do you want me to go over the surgery again with you, or do you want to not hear about it again?
Oh, she said, yep, that's great.
So, we'll make an incision straight up and down in your back, and then we're going to put the rods and the wires into your back. They're going to hold your back in a straight position. After that, we're going to have the back fused into place, and to fuse it into place, we actually use bone along the bones in the back, and it's not bone from you, but bone from somebody else called allograft bone. That will allow all the bones in the back to act like one large piece of bone and fuse into place. The rods and the wires are pretty strong. They'll hold you in your back straight for a while, but not for your whole life. but once the back fuses into place and the bones fuse, that will last forever. So I usually don't give people updates during the operation. I'm a little bit superstitious, always worry if I tell you something good, there's something bad's going to happen afterwards. So if you don't hear from me, it's good news, don't worry.
Take your time. We said we don't want you to rush.
Oh, it's okay. You're not going to, she's going to be just fine.
All right, any other questions, Alex? No?
No,
She's ready.
sure?
The anesthesia team is ready for Alex and her mother to come into the operating room.
What operating room? Which operating room?
Jay, we're going
Jay, see, I think it's the same one.
Sorry.
She was in last.
Are we ready? Strawberry mask. I'm just going to put it very gently on your face. Lower it away. Good girl.
While Alex is anesthetized, her surgeon prepares for a long day in the OR.
So what we're going to do today is we're going to straighten out her spine by using some rods and wires to hold it into a straight position, and then fuse the spine into a straight alignment. There's a little bit of a complication with this particular surgery because she has a thing called a baclofen pump that's already been placed in her back. And baclofen is a medicine that helps decrease spasticity. And in order to decrease spasticity in a more directed manner, they actually can pump the medicine right into the spinal cord fluid. And so we need to be careful not to damage the baclofen pump during the surgery, to do the surgery around it.
Now that Alex is anesthetized, surgery to straighten her spine can get underway.
I just make a little small nick in the skin, then we use electrocautery the rest of the way to really cut down on our blood loss. It's almost impossible to do the surgery around the baclofen pump without damaging it. So this is the end of the baclofen pump. This is the part that goes into the spinal cord. And we're just opening up this area a little bit so that we don't inadvertently pull this out of the spine. Because if we do pull this out of the spine, there'll be a leak of the baclofen medicine, which will cause a pretty adverse reaction.
The team must work with extreme care not to cause baclofen to leak out of the pump. A leak of baclofen into Alex's circulatory system could be fatal.
Oh boy.
It's been 5 days since 14-year-old Christopher underwent a kidney auto transplant. His renal scan showed good blood flow in and out of the repositioned kidney. Today, physiotherapists will challenge Christopher to get back on his feet.
Hey, Christopher. Well, you know what we're going to do? We're going to help you get up again today and take a little bit of a walk. Okay?
I don't want to right now.
You can do it.
Christopher.
You did a really great job yesterday.
Boogie.
Hold on
Okay,
here.
bud.
You've done it
Show
before.
us what you can do.
Okay.
That's right.
You roll away, reach your butt arm.
Excellent.
Yeah.
Very good. And
You're
up
doing
you go.
amazing.
1, 2, 3. Keep going, keep going. Good.
Okay, just the neck here. Okay,
You gonna get up?
There you go. You're doing
The catheter is in
amazing.
there.
That's okay. We're gonna get the catheter.
There. You are doing great.
Wait. Just wait a second while we get through the door.
How do
Good
I
job.
walk over here?
We're gonna walk down this way. We're gonna go towards the nursing station, okay?
Walking is quite painful for Christopher. He has had a huge incision through his abdominal muscles.
Feel a bit dizzy.
Yeah. Okay, so nice deep breathing, okay? If you get dizzy, and if you need to stop and take a little rest, you just let me know, okay?
It's been 5 hours since 15-year-old Alex was taken into the OR for surgery. The team has successfully exposed her spine without damaging the baclofen pump and have inserted wires around her vertebrae. They are now ready to begin the process of straightening her spine. A metal rod inserted into her pelvis is secured by the wires to pull her spine into a better position.
Okay, so the ends of the rod are going to go into the pelvis. Nice. Okay, perfect. Okay, now, what I'm going to have you guys do, I need to get all of the wires now we're in the right order, in the right place. And be careful not to push any of the wires down into the spine.
Pushing a wire into Alex's spinal column could result in paralysis. If this step is done incorrectly, Alex could leave the OR in worse condition than she arrived. It's been 7 hours since surgery on 15-year-old Alex began. Her surgeons have secured the metal rod to her spine to keep it in a straight position.
Take some more photograph.
Donor bone is packed into Alex's spine, so her vertebrae will fuse together, giving her support that is even stronger than the rod.
So he's just reattaching the baclofen pump now. So the pump is reattached to the part that goes into the spine. So we're doing this at the end to make sure that our spinal instrumentation and the fusion is not in the way of where the pump's going to go.
Thank you.
Alex's spine has been straightened, and her baclofen pump has been successfully reconnected. The team will now close, and her surgery will be complete.
Hello, hi. Everything went absolutely perfect. Her spine looks very, very straight. I think you and her will be very happy.
Oh, good.
And I'll be happy about that. And she really did fantastic. And so for about 3 days or so, she'll be sort of uncomfortable and not want to do very much. And then after that, she'll start to feel a lot better.
Hi, buddy. We're here. You're all over. All gonna get better now.
Worst part's over.
Have you been uncomfortable for a while? Yeah? Okay, well the medicine just needs some time to work, sweetie.
Alex's pain will soon subside as a constant infusion of morphine begins to manage it. But the next few days will continue to be difficult as Alex begins her recovery from her massive surgery. It's been 9 days since Christopher's surgery. His repositioned kidney is doing well, but Christopher is becoming impatient with hospital life.
He's getting frustrated with all the lines and stuff coming out of him, so. And all of the IVs and everything else that's going, he's just starting to feel he's had enough. He doesn't need them anymore, he doesn't think.
He'd have to drink this much fluid every hour, so that'd be 24 bags of those in a day to be off this. So they're trying to cut down. We started out with about 8 bags, and now we're down to these 2. He wants out.
He wants out and play in the snow. Yeah, I think he's pretty much ready to go home. He'd like to go home, but we've got a little ways to go yet, but I think we're getting close. A lot closer than we were a few days ago even.
One day after surgery to straighten her spine, 15-year-old Alex has been moved from critical care to the orthopedic unit. Her surgeon checks in on rounds.
Hello, good morning. How are you doing?
Good, yes, good.
Hey, your surgery went really well. You did absolutely fantastic. Your spine is very, very straight. I think you're going to be really happy with how you're looking and how it's going to be holding you and supporting you. I know for the first 3 days after surgery, you're going to feel sore and uncomfortable. People tell me they feel like they've been beaten up in a fight, and it's normal, everything just hurts. But after about 3 days, it will start to feel a bit better for you.
Alex, any questions? You have a question? Is your question, when do you get to go home?
We'll have to see how she does with her eating over the next couple of days when she's ready to start to take some stuff in. Looks like the baclofen pump looks like it's working fine, so it's all good.
Yep. I've never seen her lay where her ribs aren't sticking straight up.
Okay, have a good day. See you later.
Okay, thanks.
Okay.
"14-year-old Alexandria was born with malformed feet and has already undergone 3 reconstructive surgeries.
Alexandria, do you want to come over here? I'm just going to do your blood pressure, check your feet.
Now, a protruding bone in the bottom of her right foot is making it difficult for her to walk. Alexandria has made the decision to undergo yet another surgery in the hope she can walk pain-free.
Alrighty.
Okay.
Hi there.
Hi, how are you? Good.
So, is this bump right there?
Yep.
Okay. So we'll put a circle. And, okay. So just to remind you what we're going to do is you've got this prominent bump which is left over from when we did your last surgery. So we're going to make a different incision. We're going to make an incision down here. And I'm just going to go in and trim the bone. Now the question is what you should go in after the surgery, whether we could just leave a bandage on and you could walk on it, and we could see how that felt, or we could put a cast on with you asleep.
Yeah.
So going into the showers.
That's the thing that I think I wanted the most, because there's 2,000 kids at my school, and I get pushed around all the time.
Sure.
Because they're so tall.
Sure.
And I get pushed everywhere. And
Sure.
That's
So
what
you think with a cast it'd be a little bit better? It wouldn't need to be on very long, maybe about 2 weeks or something like that.
Perfect.
Great.
Yeah, good. You don't have any other questions or concerns?
Oh yeah, about the cast. Can it be pink?
Yep. Absolutely.
Okay.
Thanks,
Okay,
Fred.
there you go. Done deal.
You would have by default, you would have got pink.
There you go.
Unless you ask for a specific color, we usually go
Pink
pink.
for the girls.
Pink for the
Yeah,
girls. It's
perfect.
safer. Okay, good.
Great.
We'll see you
Thank
soon.
you. See you in a bit.
We're gonna go in right now.
The anesthesia team is ready for Alexandria to come into the OR.
See you in a little bit, okay? Okay. My hand. Remember, you just let them know what you want. You shortly have. Okay. Remember, Peter, go home.
While Alexandria is anesthetized, her surgeon reviews her x-rays.
She's had congenitally abnormal foot since she was born, and we did some surgery which partially corrected the position of her foot, but she still has this bump right down here on the bone, and this is now her main source of complaints, although she's much happier with the shape of her foot, which she's left with this bump, and that's actually what she's walking on. So now we're going to go in and take it out. So you can feel that prominence, which you can see on the x-ray.
The team makes an incision in the side of Alexandria's foot to reach the protruding
Can we
bone.
have the table up a little bit more, Karen? Yeah, that's the bump. And just like the x-ray showed, she's got a bump on the bottom of her foot. So you need to get the saw. Okay, you want to be parallel to the sole of her foot. Okay, good.
The bone will be meticulously reshaped until it can no longer cause Alexandria pain. "14-year-old Alexandria's foot surgery has been underway for 1 hour. Her surgeon has successfully reshaped the bone that has been causing her pain.
There, I think that's perfectly smooth now. So we'll irrigate that out. And the bump is now gone. So hopefully her pain will go away and she'll be okay. Okay, so if you could close that up.
Alexandria's foot is put into a cast to protect it while she heals.
Hi.
Hello.
Hey, well done.
How'd it go?
Yeah, it went very well.
Yeah?
Yeah. Pretty much exactly as planned. Remember I told you there was that bump which we hoped would go away, and when we went in, it was right there, just like on the x-ray, and from the inside you could feel it, and it felt like it'd be very uncomfortable to walk on.
Yeah. Right.
So she's got a slipper cast, is what we call it.
Okay.
Yeah, I think it'll be fine.
Yeah.
And it's pink, very pink, and it just comes up to her ankle, and I think it will give her enough support and make her comfortable. And she goes home when she feels she can walk reasonably comfortably. Okay?
Okay, all right, thank
Okay,
you
good.
very much.
Okay, we'll see you
Thank
later. Okay.
Thanks. Hey, are you with me? How you feeling? I can't reach you to give you a kiss even.
Alexandria will remain in hospital overnight.
Dr. Wright came and talked to us, huh? He said it was quite a nasty bump in there. Must have hurt a lot, but it's all gone, he said.
She will return to the orthopedic clinic in 2 weeks to have her cast removed. "10 days after her spine surgery, Alex is eager to go home, but a complication could delay her discharge.
You're looking awful straight there. That looks good. Yeah.
You just can't pee.
Having trouble with pee. Yeah, I know you've had some trouble with that in the past. You know, there's a lot of reasons why sometimes it's hard to do that after this kind of operation. Sometimes even some of the nerves that go down to the area might get stretched a little bit when your spine is straightened out. That might make things hard to go out. I don't think that's the problem though, because everything else seems to be working okay, and it's working sometimes, which makes that sound like it's not the case. You know, there's no reason for you to rush to go home. So if you're not feeling comfortable, if you're still feeling a little bit uncomfortable, you don't have to rush to get out of here. On the other hand, I don't think there's anything medically bad going on. And so if she really is very anxious to get out of the hospital and go back home, it's okay with me for her to do that. If you're, you know, as long as you're comfortable with all the things that you might need to do.
Yeah, I'm fine. I mean, I just wanted your opinion to see if you thought there was anything else happening.
Yeah. Like I said, you know, there always is a possibility there could have been something from the nerves from the operation. But again, the fact that everything else is actually fine on her neurologic examination, and the fact that it was working okay afterwards makes that awful unlikely.
So you think we could go today?
If you want, yeah, it's okay with me.
All right. Okay. Is that good with you? Does that fit in with your schedule?
Let me tell you what we're going to do. You're going to feel a little...
13 days after his kidney auto transplant, the day Christopher has been waiting for has finally arrived. The large intravenous line inserted into his neck will be removed.
I'm going to just take the tape off here for a second. All right, there's some hairs there that are going to bother you as I take
Can I take the tape off it?
Well, you can't because the line's attached to the tape.
Okay, so I won't.
So I got to see it, okay?
I like it how you're not doing it too fast. You're not doing it too slow either.
Yeah, it's all right?
Yeah.
Am I doing a good job, Christopher?
Yeah, sir.
Huh? Attaboy. All right, let's have the suture scissors, please, first. All right, I'm going to put some pressure.
Is it coming out now?
Yeah, it is. It is, buddy. There it is. There it is.
How's that? You want to lean back a little bit?
Yeah, okay. You're good as new. So I'll see you back in probably late March, okay?
Goodbye.
All right. All the best. We'll see you later.
19 days after Christopher's surgery, he can finally go home to British Columbia.
Bye to the nurses, Christopher.
Bye, everybody.
Okay, let's go.
But until his second kidney is moved in 2 months, his blood pressure will remain dangerously high. Christopher's fight for survival is only half over. Two weeks after her foot surgery, Alexandria returns to hospital to have her cast removed.
Hi, Alexandra. You ready?
Mm-hmm.
So that wasn't too long, eh?
No. Oh, that feels weird.
There you go. That looks good.
No.
Yeah.
Alexandria meets her surgeon for a checkup.
Hi. Have you felt there to feel that the bump is gone?
Yeah.
Yeah, it's gone, eh?
Yeah, she
Yeah, I
did.
can- yeah, I
She
can-
even made me feel it. Feel it, Mom. It's smooth.
Yeah, it's smooth. So I would advise you to start walking on it. Now, do you have crutches at home?
Oh, yes.
Good. So if you need to use crutches, you could use crutches. Okay. Call me if there's any
Thank
trouble.
you. Oh, we will
okay.
do.
Okay.
Great.
Good. We'll see you later
Thank
then.
you.
Okay. Bye-bye.
5 months after her surgery, Alexandria is able to enjoy one of her favorite activities, pain-free.
I like these under here.
Which ones?
At the bottom.
These ones.
Those ones.
Well, they're a little steep.
I like them though.
Can we get one that's not quite so steep? Dr. Wright would have my head if he saw me buying these for you. You know he would. Well, here, you want to try that one on?
Okay. It feels so much better to walk.
A little less painful for walking.
A lot less painful.
A little less pressure on the outside of your foot.
Yeah.
Yeah.
I can wear shoes now. It's comfortable. Oh yeah, this one fits good.
Too big or?
No, it's fine. They feel good. I could wear these to school too, because they're black.
Because you're all black, right? You got your new shoes, right? Not too best.
I'm doing the whole thing.
6 weeks after a battery was pulled from Emma's nose, the burn in her nasal passage continues to heal well.
She was at the doctor this morning, and it's almost completely healed. It's all covered over. There's some area where the skin is thin, but it's all healed up. So we're very relieved.
Those colors?
And how the battery ended up in Emma's nose is no longer a mystery.
Emma, do you know how? Okay. Apparently it fell on the floor, someone stepped on it, then it bounced onto her shoulder and went in her nose. Is that right?
Yeah. 3 months after scoliosis surgery, Alex is able to enjoy the simple pleasure of sitting up on her own.
You ready to drive?
And Alex can once again use her head-activated wheelchair.
Chase me. Chase me.
You're so nice. It turned out better than what I was hoping for, definitely. The curvature was so severe that, you know, we just hoped that it would relieve the pain, but for her to be sitting upright and able to drive her chair again is amazing. So this is her independence.
This way?
This way.
Hurry, hurry.
Quick turn.
Are you aiming for toes?
It's been 3 months since Christopher's discharge. He now recovers from his second kidney auto transplant.
It hurt.
Hey, you just fancier than before.
He had his surgery about 10 days ago, almost. Yeah, 10 days ago almost. The scans, we've done a couple of scans after the surgery, and they look good, showing us that there's good blood flow into the kidney. His blood pressure is still going to be on the high side, probably for the next few weeks because blood vessels are made of muscles, and hopefully the blood vessels will begin to relax, and with that, the blood pressure begin to drop down. Right? And we expect to see that happening over the next few weeks.
Thank you.
All the best. All right? Good man.
Thank you very much, Dr.
Dr. Curry.
Okay, you guys.
Isn't that good? Go for a walk without dragging that big pole along with you?
Yeah.
Christopher will continue to be monitored by physicians at the Hospital for Sick Children and at home in British Columbia.
You want to hold my hand?
He may always struggle with his blood pressure, but now that his kidneys have been repositioned, he has his best chance for a full recovery.